I was asking you that the FMC, in their own response to what has happened, say that there are feedback systems in place like QR codes where patients can actually, give feedback if they are dissatisfied with services in the facility. Now, how effective is that feedback system, and do the patients actually know that this is in place?
Yeah, I'm with you.
Okay, did you hear my question, or I need to ask it again?
Yeah, I understand the question, that how effective those feedback mechanisms. Yeah. Yes, you may have all those gadgets there, which qualifies a center to be a center with medical legal environment. There must be officers who are in charge of those gadgets, monitor it 24 hours, and have a positive or a negative feedback. And our team manning the accident and emergency unit must be well trained. Drills must be on, frequently, so that they should be alert at any time. So where this is, absent in public setup, of course, the reflex will not be so sharp as to react to incidents. I am aware that some public institutions have frequent drills on emergency preparedness. Most, high-level private institutions do this from time to time. We should have this in our public institution. Frequent drills, simulation, and, good motivations of the staff, together with staff attitude. We all have ethics, for God's sake. We work with ethics of our profession. So, and one of those things that is common to all professionals is that you must be empathic. Treat a patient as if you are the one.
Okay. Now, okay. Go ahead, Prof.
So, I expect that feedback mechanism must involve, changing staff attitude to work. Motivate them. But let me just add quickly. I have seen situations in some public hospitals where professionals go extra mile to help those patients, but at the end of the day, they are punished. Their salaries are deducted for allowing the patient to go without payment. Yet, the patients have been saved. So these are things that we should harmonize if we really want an efficient public health institution.
Okay, that brings me to another thing. The police will always government will always tell you that medical facilities should admit patients, even with gun wounds, and don't ask questions, treat first. You just said that there are instances where medical personnel went extra mile to save the life of a patient, only to be punished because the patient left without payment. Now, where do we draw the line? If I as a medical personnel will have to go by the oath of my practice and save the life, and I have to face the brunt of my organization because the patient refused or failed to carry his or her own responsibility, how do we draw the line for me to be motivated to save lives and risk my job? Or should the government have a way to compensate if such happens? I'd like you to help us in this. Prof.
We have emergency fund from the National Health Insurance Authority.
Okay.
There are emergency funds that should be used to attend to this type of patient. Of course, even in private hospitals, patients live and, without settling their bills. There's nothing you can do about it. But the conscience is there. If policies are well streamlined, we should have enough funds to treat, these patients, these indigent patients.
Now, Prof, from your years of practice, have we had instances where this emergency fund is deployed to defray expenses hospitals incur by going the extra mile to help patients? Do you have cases where the government intervened with this emergency fund and pay it off?
Sure. Even in that Jabi center, I've had calls to refer patients there. And patients were treated. Emergency funds within the first 24 hours are utilized. However, there are still certain fraction of patients that will leave the institution without showing gratitude, without paying back. I am aware the funds are available, emergency funds are available. But what we are advocating for is that this fund must be well managed by authority who, from time to time, boost the stock in various health institutions. It should be well coordinated so that the attending hospital just submit bill and instantly it is replenished. Those funds is replenished, instantly. We shall get to that level. But for us now, I know there are centers who have activated that emergency fund, and it is working. Jabi is one of them.
All right, Prof. People are actually wondering that if things like this are happening in big facilities like FMC, what is now the state of smaller healthcare centers like the primary healthcare in the rural communities? Are they getting enough attention as they ought to?
About 8,000 primary healthcare centers have been reactivated by this administration within the last 2 years. What we are advocating for is not just reactivating. We must make them functional like other big hospitals. Unfortunately, there is still dearth in the number of hands that are available. Of course, the Japa syndrome is there. It cuts across all professionals. Do we have enough doctors that we can post to primary health care centers? There may not be enough. And if there are enough, are the local governments who are supposed to be directly in charge of primary health care centers ready or have capacity to employ a doctor to man each primary health care centers?